But if you go off and you kill the normal fungus that's in the vaginal area, and now bacteria that is very nasty has enough room to where it can breed uncontrolled, then you have not only not effectively treated what's causing you the issue, you have also expanded its ability to trouble your pregnancy. Hello moms and dads, and welcome back to Nurse Onyi Teaches. My name is Onyi, and today I will be discussing infection and how it can affect a woman's pregnancy. What a lot of moms don't know is that when you get pregnant, your hormonal activity changes. Along with the changes in your hormone activities, your immunity also lowers itself so that it can support pregnancy. If your immune system did not tone itself down, your body will consider your baby an invader and do whatever it can to get rid of it. So it's very necessary for your immune system to sort of tone things down so that you can, support and healthily carry your baby to full term. Now, the problem with a suppressed immune system is that pathogens or things that normally cause diseases that could be controlled in a non-pregnant woman can now begin to act up and cause disease or other ailments in a pregnant woman's body. I also want to call out the fact that there are many offending agents that can lead to disease in a woman's body. Some of them are viruses, some of them can be fungus, some of them can be bacteria, just different things that can come in and throw your body off balance in a way that requires you to either treat it or change, your nutrition or things like that so that you can restore the balance in your body. And this is where I need to kind of get on to a lot of moms. Many of you have reached out to me and you will give me a few symptoms, and then the very next statement is, how can I treat it? Can you prescribe something for me to treat it with? Well, we have to be very careful in pregnancy. Keep in mind that everything that you use now does not affect just you. It affects you and your baby. Also, if you just present your symptoms without going to see a doctor or a midwife or some kind of health practitioner who can adequately examine you to determine what is causing the infection, then if someone just gives you any recommendation, they can actually hurt you more than they help you. It is so vital that women go get seen, get examined. My job is to help you, lead you in the right direction so that you can get the help that you need. If you have a bacterial infection and you think it's fungus in nature, right? And you have somebody who a good friend, or maybe you describe your symptoms to a local practitioner and they say, oh, here, take this and treat this. Well, if it's bacterial and they give you something for fungus, your body comes in and uses that antifungal thing to treat what's not a problem. The issue with this is that when funguses are taken or thrown out of balance, bacteria will multiply to occupy that space. So something that, in a woman's body, there's a very delicate balance between a pathogen and disease. Some of these things can coexist in your body peacefully as long as your immune system is healthy enough to keep their counts low enough to where they don't cause you any issues. But if you go off and you kill the normal fungus that's in the vaginal area, and now bacteria that is very nasty has enough room to where it can breed uncontrolled, then you have not only not effectively treated what's causing you the issue, you have also expanded its ability to trouble your pregnancy. The problem with these pathogens is that when they get in a woman's body, they cannot affect just only you. They can also trouble your baby in the form of low birth weights. They can cause you to give birth a lot earlier than you should. It can lead to complications such as the need for a surgical birth, where if it would have been controlled from the beginning stages of the disease, then that could have been avoided. It is so important for moms to make sure that they know what's causing an issue before it's treated. I'm not saying that, herbs or anything does not work. It's just make sure that you are using the right type of herb. And then beyond herb medicine and things, it's very important for you to have a relationship with your provider. Sometimes herbs may take a little longer to work than is typical, where a prescription will come in, knock it out, get it completely cleaned out. Make sure that you are prioritizing your health and your baby's health, and that you carefully watch what you take to treat any condition. This is for your own good and for the good and health of your pregnancy. Now, if you know any friends or family members who can benefit from this information, be sure and share it with them. We want every mom as informed as possible so that she is making healthy decisions for herself and for her baby. If you also know some people, just, they don't have to be your family members, that can benefit from this, share it with them. Make sure you hit the subscribe button and turn on your notification bell so that you are made aware of every time I upload a video. Come along with me as we build this community of learners, making every mom and dad an empowered contributor to their own health care. Until the next time, be blessed.